Good evening, everyone. My name is Brenda Ahlberg, Kenai Peninsula Borough Public Information Officer, and thank you for joining us tonight on the Community Conversation. With us tonight is Bruce Richards, the Public Affairs Director for Central Peninsula Hospital, and he's going to provide us quite a lot that they're doing here at the hospital, as well as address questions that have been coming into our comment threads. Before we do that, I also want to welcome Dan Nelson, our incident commander, to provide us an update this evening. Hello, Dan.
Good evening, everybody. Bruce, thanks so much for joining us tonight. I'll be brief with my update. We'll get right into some things at the hospital side of the house. But I just wanted to let folks know a couple brief things and concentrate a little bit on some safety. So we did have one additional case confirmed positive for a Kenai resident here. So that was included in the update tonight. And I really want to talk about, as we talk about some of these cases that are increasing, and as we have more and more talk and more focus on flattening the curve and doing some of these things, that we're sure that we're taking some of the precautions and some of our advice seriously. We've been talking about staying inside. We've been talking about flattening the curve, but I'll say that, some of the things I hear and some of the observations of just traffic in town is we still have a lot of that. We have a lot of people out and about doing things, and we certainly recognize that a lot of folks are out doing essential business and making sure that our community and our infrastructure is still running. But if you can avoid going out, if you can avoid excessive trips to the store and to the pharmacies and those types of things, we need to do that. Now is the time for us to get out there and make sure that we are still following our social distancing and keeping that physical distance from each other. And we know that it's been tough, and it's certainly been a few weeks now that we've been talking about this. We're still talking about this now for certainly the foreseeable future, but it's that time to buckle down and make sure that we have that done, and that we're taking all of those precautions for ourselves, for our neighbors, for our community members, and for folks like the staff at Central Peninsula and South Peninsula and Providence Hospital and all of the doctors and physicians' offices, making sure we're keeping our healthcare system safe and running just as much as we can. So let's take that to heart and remember that. And I'm not going to take any more time. I think a lot of folks are tuning in for Bruce and some hospital perspective on things. So I'll get us started there.
Welcome, Bruce. Wanted to ask you if you don't mind giving us a bit of a detailed introduction, and what is your position in your incident management team during this time frame?
Sure. Thanks, Brenda. So my name is Bruce Richards, and I'm the Public Affairs Director here at the hospital. I'm also the Public Information Officer for the hospital's Incident Command team. A little bit about myself. I grew up here, came here in the late 60s, been here ever since, and was here before we had a hospital, and now I'm working in it, and I'm happy to get to people's questions and let them know what they've been wanting to know to get at the real issues here. So I'm ready whenever you are.
Thank you, Richard. Boy, one of the biggest questions is, has there been a change in how testing is being transported, and why? And what are you guys doing to resolve those transportation issues?
So testing here, it has been a little bit of a challenge, but I think it's fairly worked out now. Right now we use FedEx to run our tests Monday through Thursday, and then we do a joint courier with South Peninsula Hospital Friday and Saturday, and then on Sunday a separate courier runs the samples up to Anchorage. So it was a little rocky. It was hard making connecting flights. Most of our tests go to Fairbanks, and so we had to make some tight connection times. And then on the weekends, there were some issues with freight sitting there overnight, and so samples would have to sit there in ice coolers, which we don't want to do. So that's why we've joined up with South Penn and running them up on the weekend, driving them up to make sure we can get them up there and get them turned around.
One of the other questions with regards to the testing capabilities is, what are the testing capabilities in the hospital? Is that, you said you're having to drive it, obviously, so it meets that Fairbanks deadline. Is there talk about having local testing there at the hospital?
So currently what the hospital does now is we basically collect specimens. We don't do the tests. The actual tests don't occur here in the hospital. We collect specimens from patients, and we ship them up to Fairbanks, whether it's by a FedEx or driving them up to Anchorage and then going the rest of the way. But so we just collect specimens, and there is no in-hospital capability for providing these tests. I don't foresee that in the very near future. There's a lot of talk about testing in hospital labs, but quite frankly, the ones that are able to do it, that are producing these test kits, they're getting sent to all these hot spots where you're seeing major breakouts. And so I don't see us having that capability, at least even in the month of April.
Good to know. And I think that's a good clarification for our audience as well, as they've asked that question several times. With regards to testing, there's also some facilities on both sides of the peninsula that have offered a drive-up testing. Is that something the hospital will be doing?
So drive-up testing means different things to different people, and I want to be very clear about what that is. We do have a service where if you went to your family practice physician and they ran you through the algorithm and that figured out that you have the symptoms, you have the travel history, or you have the contact, that you should probably get tested, then your provider would fill out a form from state epidemiology and call over to the hospital, send those forms over, and then they would send you over in your car. And what would happen is we'd have you drive up through the emergency room entrance there, and somebody would come out and actually perform the swab to collect the specimen. And then you would drive home and continue to isolate until you found out what your results were. And even if you are negative, obviously, if you're not feeling well, probably should isolate anyway, so we don't pass the other stuff around as well. But that's what drive-up testing here is. It's done by a physician order. Not everybody can just come get a test because they want one. That's not how it works. There's not enough tests anywhere in the country to do that I'm aware of.
And just to be clear for folks, that there has to be a provider recommendation, referral, and there's basically a coordinated effort to protect both staff, patients, and the individual who's coming up to have the swab done, the swab sample done. And there's a big difference between swabbing, the swab kit, and the actual test kit. And Dorotha shared that with us last night as far as what that difference is, but I don't think it would harm anyone to hear about that again. What is the difference between the swab and the actual test? And it's not a Q-tip, I do know that.
It is not, but yes, there is a difference. Obviously, again, we don't perform the actual test here. We do a lot of testing here at the hospital for other things. We can test for influenza and many other things, but COVID-19 isn't something we have the capability to test for. It's a very complicated test to run. It's about a 4-hour assay to run, or a 4-hour test time to do. And so 2 hours of that, my understanding is that it's an RNA test, and the RNA has to be matched up with the DNA before you can actually run the real test. So it's 2 hours just matching up RNA and DNA, and then you run the test, which takes another 2 hours. So a complete time of 4 hours. So it's a pretty complicated test as far as lab tests go. It's not one of the easier ones to do where you just stick it in a machine and push a button and results pop out. That's not how it works. It's very complicated, requires a lot of training, and they're doing that in Anchorage and Fairbanks. And there's some private labs, which I should mention, we do have tests that we send out. We have a contract with the Mayo Clinic in Rochester. And so some tests do get sent there where the state won't run a test. Maybe a provider's ordered a test and the state doesn't agree that it's serious enough to warrant them running a test. Then those get sent out to the Mayo Clinic. And so turnaround times, people wonder about that. We have, it's around 48 hours here in state to get the tests. Once we get them up to the lab, get them up to the lab and get them back. It's about 48 hours. And it can take considerably longer for the ones that go outside to Rochester, Minnesota. And even they are overwhelmed at the Mayo Clinic. And even they send some out to their other facilities. It may go all the way to Minnesota and then back to Washington State or some other place. So it can take some time. To date, we've run 98 total tests here at the hospital. 84 of those were negative. We've had the 3 positives from the hospital. As we know, there's other positives on the peninsula. That tells you that there's other people that are conducting tests, including South Penn. We know about the Denina And I think there's some other private practices that are collecting specimens. So, but we've had 98, 84 negative, 3 positive, and we have 11 outstanding awaiting results right now. We don't have any rule outs in the hospital right now. We've never had a positive COVID patient in the hospital yet.
And that's what you mean by rule out.
So we've taken a test, and while you're waiting for it to come back around here, they call it a rule out. We have had, I believe, about 12 inpatients, people that have come in, were ill, showed very similar symptoms. And so it was worthy of making that test to rule it out. They were admitted because they were sick enough to be admitted to the hospital. And so we call them rule outs, and we're waiting to rule out COVID before it's just a rule out. I guess I'm struggling to come up with the term, but when we have a specimen here and they go up to the floor in admission, then we're waiting to rule them out, and we call it a rule out here.
I understand. I just wanted to make sure folks understood that as well. And it's a process of elimination for all a safety first and foremost,
right,
and the type of treatment for the patient, I'm sure. And I think that's also bearing reminder to our public that there's tests prior to actually running COVID if it has to do with respiratory illness symptoms in general. Is that correct?
That's right. Yeah. So, a lot of the symptoms are similar to other things. You might have the flu, you might have pneumonia, and we can test for those. And so when people present that way, we'd like to rule those out first before we get down to saying, yeah, we've ruled everything else out. COVID-19 test is probably the next step, because we need to preserve those test kits because they're in high demand around the world.
Thank you for that. Wanted to bring up the question that's also been asked several times is, what type of protocols do you have at the hospital to protect patients and as well as personnel, both your non-medical and your medical staff?
Well, as you know from several of the press releases that we've put out, it's mostly been around those items. The hospital is fairly well locked down, as is Heritage Place. I don't want people to forget about Heritage Place. That is part of Central Peninsula Hospital. That's our long-term care facility. And, they have been really severely locked down based on national recommendations from their association. And so no visitors going in there unless it's absolutely necessary. We're talking end of life, and that's about it. And similar at the hospital, we screen everybody that comes into the hospital, whether it's a patient or a visitor, and visitors have been restricted quite a bit as of the last mandate. And it's not quite as tight as Heritage Place, but we are screening and making sure that people that are coming in are safe. Obviously, our goal is to keep our current patients safe, but also, our frontline healthcare staff and everybody that works here in the hospital. Like, if this thing were to go drastically bad somehow, we want those people to be healthy to take care of people. And so it's really important that we're keeping a good eye and watching as people come in here. So those are the things that we're doing. There's a lot of social distancing going on within the facility. The cafeteria has been closed, the gift shop's been closed. The cafeteria is open to staff. It's one person per table. If you recall going in the cafeteria, we can have one person at each table, and there is all you can have. Nobody can sit together. So there's a lot of measures. We've talked about, people have asked about housing for staff at the hospital here, like if they needed to be separated for whatever reason. Things that come to mind are families that have, employee or spouses, partners, family that work on the slope. We saw today there was a case on the North Slope. So if somebody was coming home off their shift, obviously they're going to have to quarantine for 14 days. And if we want, the person from the hospital, the employee, to be able to come back to work, we really can't have them in the same place. So we're looking at housing options for employees. We've been surveying and talking with the hotels here and finding out what's available. So those are some of the things that we're working on to keep everybody safe. And then, of course, we'll talk a little bit about personal protective equipment and things that are going on inside the hospital as well.
Are there also those staff members that are teleworking or telecommuting for the hospital?
Sure, sure. We're like anybody else, and those that can do their job from home or some other location. We are doing telecommuting and having those people stay home and reducing the amount of people entering and leaving the hospital on a daily basis.
I want to talk a little bit about alternate care sites, but before I do that, one of the things that it was also wanting some clarification on is with regards to the living quarters for medical personnel. That is a plan in place in the event that there's an actual COVID patient that would be admitted into the hospital.
I'm not sure I understand your question when you say living quarters
for medical personnel. I know in other facilities I've seen that just to protect the personnel because they don't want to take them to go home and potentially expose their family. Is there a plan in place so those medical providers have an alternate place to sleep, to rest? Yes.
Well, not necessarily to sleep. I mean, that certainly could come up, but what we have put in place and what we're continuing to work on and put in place is, people having the proper personal protective equipment, scrubs. So you come to work, change into scrubs and do the shift and everything and take those off, change back into their clothes, kind of leave that stuff here at the hospital. Obviously, we've all seen all the stories on the internet about healthcare workers who go home and the routine that they have, that they go through to make sure that they're not bringing it home. Some people get undressed outside on the doorstep, and there's a lot of things. But the main thing we can do is provide them with the proper equipment they need to keep them safe, and then have them use it properly. Provide the training for it, and so that when they do go home, that they're not bringing something home to them. And scrubs is part of that. The proper personal protective equipment, all of that's part of that plan.
What is the alternate care sites? What are you guys looking at for that in the event of your moderate care needs? Can you talk us through that a little bit?
Sure. Yeah. So that's one of the big things everybody's doing now. I mean, we've watched in other places that are, haven't done what Alaska's been doing. Quite frankly, I think that we're doing a really good job early on. We're looking at these mandates, we're social distancing, we're practicing all these things to flatten the curve and hopefully reduce the impact that's going to come here. But nevertheless, we need to plan for that. And so planning for surge capacity. The hospital recently, yesterday, our OB department, for instance, moved up to the new section that just got completed. So, right behind the wall next to me is the OB department, and there's a lot of vacant rooms that are now, as we speak, getting converted to additional beds in the event that we need them to surge into. We have 6 different places that we're talking about surging into, and if we used all of them, it would be 144% increase in our capacity at the hospital. We would more than double the inside of our hospital. Hopefully, if we all keep practicing what we've been doing, we won't ever need that, but we're planning for that. We're planning to have all of that available, and we'll surge into it as we need it. But we think that having the capability to serve people here in the facility versus starting something off site and having to split up personnel, we're going to start here and then work our way that way. And with that kind of capacity, I'm hopeful we don't need to go off site, but we've been planning with your incident management team in the event that should happen. We're also looking at that as well. So we're doing a lot of internal surge capacity, alternate care planning here.
Dan, I want to bring that to you with regards to one thing I noticed in our incident action plan was our peninsula is divided into different divisions as it relates to mass care, alternate care, and other types of response. Can you share with us what exactly those divisions are and what does that mean?
Certainly. So as we go through our planning for any type of incident, we break the peninsula into those geographic divisions. And that's for a couple different reasons. One is, of course, simply the peninsula is a big place, and what works here in the central peninsula might not be suitable for something in the Seward area or in the Homer area. So we break those into 4 geographic zones. And I think here we actually have kind of the 3 zones. So Central Peninsula, and then South Peninsula and the East Peninsula. When we work with these healthcare facilities here, Central Peninsula Hospital or South or Seward Providence, we're kind of going through different steps to make sure that surge capacity, in other words, when the hospital is over its expected capacity, which is different for each hospital. So we hear about CPH at potentially 140%. There will be a different number for the other hospitals and healthcare facilities. The borough supports our health service areas with those alternate sites. If we had to open another facility at some other location, if we had to divide people up, if we had to have that additional capacity, that's a big part of what we do at an emergency management level, is be able to support that. The borough doesn't do its own healthcare. We do that through contract with providers at our two hospitals, Central and South, are borough owned, and they are operated through a contract. So we provide that support. So in the same way, we firmly believe exactly what Bruce is saying. We'd rather be in the hospital. If you're a patient, you want access to those facilities, those things that are custom made and designed for good quality healthcare. But we also always plan for the worst. So when that surge happens, we work to have those plans in place. So that's been a big focus. And you can imagine that logistically, all those things that makes a hospital run each day, whether that be food services, environmental health, whether that be the built-in medical systems, simple things like oxygen delivery and all that. We kind of take that for granted if we go into our hospitals. We just have things to plug into in our room, and all of that stuff works. But when we're talking about a different location, now all of a sudden you're in a completely different thing. It's a very specialized trade. So we've been talking about these alternate care sites for a number of evenings now. We've been working on it since this incident really began, and it does take some time to develop those things. So that's why we divide those into different zones and go through that planning, because that all looks a little bit different based on where we're at. But the ultimate goal is to, as much as we can, support that healthcare system.
Thank you. A good example was last night with regards to how you're going to med transport individuals from across the water. That's completely different in Homer or even in Seward for that matter. Not that we have very many folks that are living across Resurrection Bay. Bruce wanted to, I'm sorry, go ahead.
Oh, I said exactly. It's all those different things. And that's part of the reason why, even when we're not talking about this particular incident, we do divide things up into zones, because each have their own characteristics, their own infrastructure, and our plans have to be tailored to meet that.
Bruce, one of the biggest questions is how many ventilators are at CPH and what kind of equipment do you have?
Sure. So ventilators, let's just, so what is a ventilator? Let's just start with that. Ventilator is a mechanical device and it feeds oxygen into your lungs of patients who have severe respiratory problems. And, for these severe cases, sometimes it requires insertion of a tube down into your airway to help you get enough oxygen, because parts of your lungs aren't able to absorb the oxygen. So you basically are increasing the amount of oxygen by inserting that tube down. Sometimes it can be a mask at first and then going to a tube where you would be intubated. But so ventilators, I know there's a lot of interest in ventilators. We have 5 ventilators here at Central Peninsula Hospital. It's kind of a normal number for the amount of hospital beds that we have. So about 10% of our rooms could have a ventilator. And, there's other options that people are talking about, an anesthesia machine can be used as a ventilator. However, it would require an anesthesiologist tied to it, all the time too. But I think, the big thing about ventilators, and one of the things that I keep hearing a lot of talk about it, but I think the biggest thing is that we all need to do is continue practicing what we're doing so that we don't need ventilators. If we can flatten this curve for those people who will eventually need ventilators, we'll have them. And, you can go buy ventilators right now if you wanted to. So we need to all just do our part, get out there, actually stay home, not get out there, flatten the curve. We need to stay home and flatten this curve so that we can preserve those ventilators for those who become really ill and need them. And if we can lower the amount of that curve, not as many will need them all at once. And so that's the big goal. That's the big message about ventilators. I know there's a lot of talk about it, but like I said, they're kind of like test kits. They're hard to come by. So the best thing that we can do is to make it so they're less necessary by flattening the curve.
Very well said. And with that, there's also CPH has a call for specific protective equipment, personal protective equipment, PPE as we call it. And can you share with us what is it specifically that the hospital is looking for so that staff can be protected?
Sure. And before I get into that, I really want to say something about that. Last week I got a phone call from Gary Turner out at Kenai Peninsula College, and he called me up, and I've known Gary a long time, and he said, "Hey, we want to help. We know that there's a lot of PPE requirements, and we have some of that from our programs. We've been partners with Kenai Peninsula College for a long time because of their healthcare programs out there. We hire a lot of their graduates." And so he said he has this stuff, and I said, "Great, that's awesome. Why don't you send me a list of what you have, and I'll get it to the right people, and we can tell you what we need." And we hung up, and that email was already in my inbox with a perfect list, totally inventoried. I sent it down, and it wasn't very long after that equipment was here in the hospital. And that's the kind of partnerships that I really love about living here. I haven't been here as long as I have. It's just amazing to watch the outpouring of support from community members, local businesses. It's just amazing, and I really want to thank Kenai Peninsula College and Gary Turner for what they've done. It was a significant donation. I'll be putting something out later. I'll show you. Took a video of it to show you what we have, but it was, gloves and masks and all kinds of things. So I really want to thank them. Blue Crest also dropped off stuff here the other day. Big thank you to Blue Crest. And then Marathon Oil, corporate office from Ohio, sent us 10,000 masks yesterday, 9,600 to be exact. I mean, it's a significant donation as well. So anyways, but like we've been talking, nobody really knows where this goes. This is the equipment that all of the healthcare providers need to stay safe. In my opinion, you can't have too much of it right now, just knowing the uncertainty of how this goes. So, but yes, we did. There was a lot of people asking what they could do to help. So, can we sew masks? That was one of the big things that's been happening out in the rest of the country. And we kind of got our act together and figured out how to put that together and make it so people could donate masks. So yes, we are accepting homemade face masks. We have a page at cpgh.org/face masks, and people can go there. There's a pattern. There's all the instructions about how to get them to us, what will happen with them. But basically, just to follow up on that, put them all together, put them in a plastic bag, drop them off at the front door. We'll take them. We'll run them through our laundry here, and then we'll disperse them to the employees and patients and everybody that needs them here. So that's the homemade side of things. And again, that's on the website, and people can. My mom dropped off 20 yesterday. So, and then there's another piece of it, which is kind of what we started out with, PPE donations and PPEs, personal protective equipment. As you can imagine, a lot of that stuff's hard to come by. It's like ventilators and test kits. So the more that we have on hand, the better. And so we have put up a page for that as well. And at cpgh.org/donations. And what we're asking people for is, like we get exam gloves, latex-free gloves, face shields. A lot of companies and businesses have, these are the kind of things that are used. Goggles. These are washable, they're reusable. We can use them over and over and over again. N95 respirators. A lot of businesses use these. You'd be surprised how many businesses use these. And if people have extra and they feel like they want to donate them, that would be great. Those are the kind of things. We have, what we call simple masks or procedural masks. And what we ask is that if people have them and want to donate them, if they need to be new and in their original packaging. I can't at this point promise that we'll get stuff back to people that do make a donation, but we certainly are accepting those and appreciate anybody that dropping them by. So that's kind of the donation side of thing, both the homemade and donating stuff that businesses have that want to help.
That is a great celebration. That is the neat thing about living in this town. I've only been here 30 plus years, but I totally agree with you. Can't tout the fact that I was born and raised here, but don't plan on leaving. I want to ask you a couple more questions. You talked about dropping things off at the front door, but what if someone has an outpatient service, such as getting labs or imaging done? How's that happening? Can they still do it?
Sure, absolutely. I mean, people are going to continue to have requirements, medical care needs, and outpatient labs is a common one. Some people need to have, their labs done quite frequently, still doing that. So still do it like you normally have. You come to the hospital, the front's open 7 a.m. to 5 p.m. Monday through Friday, and you'll get screened like everybody else. But once you pass through the screening, if you make it through the screening, hopefully everybody does, then you just proceed on your way to the lab, the outpatient lab, just past the registration desk and do your labs. Or if you're, we're here for an image for some reason, same thing. It's still operating as usual with the exception of screening at the door.
And what do you mean by screening? What can folks expect for that?
So it's a health screening. We want to know that you run through the algorithm, that you don't have all the symptoms, that you don't have the travel history, that you don't have a positive contact with, somebody that's known COVID-19 or having recently, again, the travel part coming from, a place where there's community spread going on or one of the countries. So it's basically just several questions that we'll go through. They'll ask if you have a fever, been feverish, those kind of things. But we just want to do the best we can before we let somebody through the front doors, trying to keep everybody in here safe, the patients that are here and the employees.
Very good. And last question, and then I'm going to turn it back over to Dan for some closing comments. Well, actually, two more questions. What are the visitor restrictions into the hospital?
So the visitor restrictions, those came down in the last mandate. I believe it was number 11 for social distancing. And there's an FAQ out there on the state's website, and they talked about visitation at the hospitals. And so there's some exceptions to that where you can go, but for the most part, visiting is really shut down, at the exception of end of life care. And if somebody were to come here for, let's say that somebody needed an outpatient day surgery that wasn't elective. Of course, we're not doing those anymore. But if there was an emergent surgery that could be done outpatient, then you need to have somebody here that's going to be able to safely drive you home and take care of you if you've had anesthesia. So those are some of the exceptions to that. We are doing visiting via FaceTime and letting people use their phones or iPads and things like that. That helps. But for end of life care, that's probably the single biggest one where letting family members come in, and it's one at a time. And again, you'll get screened as you come to the door, but for the most part, there's very little visiting going on here.
Bruce, do you have any closing comments, some key messages for our audience tonight?
Well, I think, I've said it several times tonight, but, there's a lot of concern. People are a little bit anxious about this whole thing, watching things happen in the rest of the world and the rest of the country. But I think as a state, we've got a good jump on getting ahead of this. And, if we can continue to follow these social distancing rules and the mandates, and, I get it. It's hard. People, don't want to be cooped up at home. You can still go outside, went for a walk last night. But if we can follow those and we can flatten this curve, that is probably the single biggest thing we can all do to have this thing pass us by. And I really encourage people to do that. And just continue to hunker down for a while until the worst of this is over. And if you do need medical care from anybody, not just here at the hospital, your family practice physician, if you feel like you've got to go see somebody, please call them first. Let them know, so that they can kind of give you that same screening over the phone. Same thing, if somebody's calling an ambulance and you're just, you think somebody in your household might have this because of the symptoms, let them know when you call the dispatch. They're probably going to ask you anyways, but call ahead, let them know so we can protect the first responders and the folks that are providing healthcare in the outpatient clinics, the physicians and the nurses, and everybody that's out there. We need to protect all of them so we can continue to take care of everybody.
Great information tonight. Thank you so much, Bruce, for joining us. And Dan, I'm going to punt it back to you for some closing comments, please.
Absolutely. And once again, thank you, Bruce, from the Central Peninsula Hospital for joining us and really providing some great information based on some of the things coming from the hospital perspective. So very, very valuable. And, I'd like to tack on a little bit in closing just to what Bruce said. And, we've talked about preventing that surge, preventing that when everybody needs that same thing at a hospital all at once. That's really what we're talking about. We talk about alternate care sites. We talk about all these plans and preparations that I certainly hope we're not going to use. But your teams, whether it's the borough team, the healthcare team, everybody is working hard to try and make this work. So how can you help? Stay inside. If not for us, if not for you, not for your community members, I'd ask everyone to think tonight after this conversation. Do you know somebody that works in healthcare? Do you know somebody that works in a physician's office or at one of our hospitals or comes into contact with patients or does in-home care? Whatever it happens to be, let's think about those folks that are working, I think, many extra hours, many extra shifts under increased conditions and all of these extra things to keep themselves safe and to keep their patients safe. And that means you and I. So let's do that. Let's stay inside. While we're staying inside, let's be mindful of safety and taking care of things. So one thing that got brought up today, as it's coming into spring, a lot of us might be getting propane deliveries or fuel oil or ordering online for different things, since most of us are staying at home. I know I'm getting a little bit bad at that. It's easy to order those things. When you've got those delivery drivers, the post office, UPS, the fuel oil driver, while they're delivering things, while they're taking care of your home, stay inside. Most of those options are being given so you don't have to sign a slip online or do different things or not have to do that. But let's do everything we can to prevent the spread. And of course, as we've been saying, go outside, take a walk. Go to the trails, ski, whatever that happens to be, but maintain at least that 6 foot of social distance. Let's protect ourselves, our community, and our healthcare workers. So once again, Bruce, thanks so much. Brenda and I will be back tomorrow, 7 p.m. here on Facebook Live. Submit your questions on KPB Alerts on Facebook, and we'll do our best to answer those and get those answers to you. So thank you, everybody, for joining us. Have a very great evening, and we'll see you tomorrow night at 7.